Welcome to Diversity, Equity, Inclusion, and Belonging. Module 3, A Sense of Belonging. The learning objectives for this module are to define belonging, examine the human need for belonging, review what loneliness is and its relationship to belonging, explore how to utilize the therapeutic nurse-client relationship to promote patient belonging, and discuss strategies nurses can use to promote a sense of belonging in their workplace. The YMCA of Greater Toronto defines belonging as the result of diversity, equity, and inclusion. It's a feeling that your authentic self is valued and understood. Belonging is an outcome that groups or organizations can support through their actions and choices with respect to equity and inclusion. Although inclusion and belonging share similarities, they are different. As discussed in the previous module on inclusion, embraces, respects, accepts, and values diversity. It is a mindful and equitable effort to meet individual needs so that everyone feels valued, respected, and able to contribute to their fullest. Belonging is a feeling that someone has. However, attempts to help an individual feel connected in their environment doesn't always make them feel like they belong. Because individual attempts to be inclusive may not generate a sense of belonging, it is important that all members of the healthcare team work together to create a culture that is respectful and values the contributions of each member of the team. Human beings have an innate desire for a sense of belonging. It plays an important role in the overall well-being and supports engagement and connectedness within communities, which can be indicative of a healthy population. As a social determinant of health, belonging relates to social supports and coping skills. Whether it's a family, spiritual group, political party, geographic location, or nationality, people often label themselves and others with the many aspects of their lives, becoming organized by which groups they belong to. Belonging is also important for physical and mental health and can help with the management of stress. Some mental health conditions are linked to a lack of the sense of belonging, which can perpetuate people who don't feel like they belong to retreat further. Loneliness is experienced when people feel there is a deficiency in their social relationships. If a person does not feel a sense of belonging that meets their desired need, the subjective experience and feelings associated with it are the effects of loneliness. Loneliness puts people at higher risk for adverse health conditions such as coronary artery disease and stroke, and may even increase a person's risk of developing dementia later in life. In fact, the health impact of being socially disconnected can impact mortality as much as smoking up to 15 cigarettes per day. Although people have many social interactions, intimate connections with those who provide a sense of belonging are more important than the number of interactions or even the number of people you know. The College of Nurses of Ontario focuses on the importance of the therapeutic nurse-client relationship as a crucial element contributing to the overall well-being of the patients nurses care for. By effectively utilizing therapeutic communication, client-centered care, and maintaining boundaries, nurses can build a relationship that is based on trust, respect, empathy, and professional intimacy, helping to develop within the patient a sense of belonging. In some practice settings, a longer-term therapeutic nurse-client relationship may be developed due to the nature of the environment. For instance, a nurse in the community or in long-term care may care for a patient for months or even years. When nurses and healthcare professionals are entering a patient's home or the place that they call home to provide care, they are presented with an opportunity to develop a therapeutic nurse-client relationship that, while professional, supports the patient's sense of belonging and their overall greater well-being on a scale for longer periods of time. During and after the COVID-19 pandemic, social isolation and loneliness increased, with many reporting that they often feel lonely while they are working. As leaders, nurses have influence and play an important role in creating environments that support belonging. Practicing self-awareness is important because we may all have biases and be unaware, Biases can be conscious or unconscious. By being self-reflective, we can help to identify biases we have and work towards addressing them. For resources on how to become more aware of your potential biases, view Module 5, Assessing, in the Cultural Competence Practice Resources, available on the WeRPN website. Building relationships is a strategy fueled by open dialogue. Lived experiences shared through stories can provide a safe space where people feel comfortable to share and learn from one another. Can you identify someone who might not feel a sense of belonging within your organization? This could include students or recently graduated nurses who have joined your unit, or a patient who may feel disorientated while searching for their room. Nurses and other healthcare professionals should approach these situations with mindfulness and empathy, actively striving to cultivate a welcoming atmosphere. While interacting with a student or new graduate, take the time and initiative to ask them questions to better understand their background and experiences. Fostering social connectedness may prevent nurses from leaving the profession and support nursing students to be more engaged, feel more satisfied with their education and clinical experiences, and enhance their overall well-being. Similarly, when encountering a patient who appears lost or needs assistance, refrain from simply directing them what to do or where to go. Instead, considering offering assistance, asking if they would like guidance to complete a task or to get to their destination. This simple gesture can go a long way in making them feel cared for and supported. Technology has led to the development of tools, for example, translations apps and software that can be used to help to promote a sense of belonging. As technology advances, nurses can support belonging by seeking ways to incorporate new tools into their practice. Language supports may already exist in your organization and are possibly underutilized. If your organization does not have language supports or you are unsure of what supports exist, consider discussing with your leadership at your organization as to how these supports can be utilized to better promote a sense of belonging. The healthcare system can be difficult to navigate, and for people who lack a sense of belonging, it can be a daunting task to access the care they need. Helping patients navigate the system and connecting them with system navigation resources may support their sense of belonging and allow them to access services they would otherwise go without. And finally, nurses can help to support belonging in healthcare by encouraging others to express their identity, beliefs, and the beliefs that they have for their own potential.